Welcome to AHVC Heart Channel, a podcast that explores the wonders of the human heart. I'm your host, Joseph. Today in this episode, we have Dr. Liew Matthew here with us to share about Unstable Coronary Heart Disease. And we are very excited to learn more from you today. Welcome, Dr. Liew.
Good morning, Joseph. Hi, I'm Dr. Liew, and I'm an interventional cardiologist. So I do coronary angiograms to assess heart artery disease and also necessary treatments via coronary angioplasty or the so-called ballooning and stenting. So essentially, it's like the plumber of the heart system.
Dr. Liew, what is unstable coronary artery disease?
So unstable coronary artery disease refers to conditions where blood flow to the heart muscles is affected due to acute changes in the heart artery structure. So patients typically present with acute onset chest pain or chest pressure, which may be sometimes associated with difficulty in breathing. And this may range from unstable angina to a frank heart attack, or what we term myocardial infarction, where there is actual damage to the heart muscles. So individuals may or may not experience any warning symptoms prior to the actual event. Most heart attack patients, they happen due to a sudden disruption of the cholesterol plaque in the heart arteries. And in a resting state, the patients may not experience any symptoms, as the degree of the narrowing may not be severe enough to obstruct the blood flow. Ohowever, during a stress event, the artery lining may get disrupted, and the cholesterol plaque therefore triggers a blood clot formation, and therefore this would then occlude the heart artery blood flow, and this is when patients start developing symptoms of a heart attack.
So why does one experience chest tightness or pain during exercise?
So when we exercise, actually the heart rate will increase, and this is a natural response. And this means that the heart muscles demand for oxygenated blood increases during this time. So if you have a narrowing of the artery that is significant, then you will expect that the blood flow cannot increase enough to meet the demands of the heart muscles during exercise. And therefore, patients may experience symptoms, and this is what we term angina. And this can be in the form of a recurring pattern where the patients feel symptoms during exercise. They get better when they rest, and then when they start exercising again, they get the symptoms again. So in the resting state, the patient's heart rate may not be high, and therefore the demand is not high for the blood flow, and so they may not get symptoms. However, one should not ignore such symptoms. They should see their doctor for further evaluation if they do experience any of these symptoms.
So what happens when one collapses during exercise? What should we do?
So if the collapse is due to a cardiac event, usually it means the heart is not pumping effectively to circulate the blood to the vital organs such as the brain. And this is a medical emergency where the bystander response is important. They will need to take immediate action to help the individual. And so if it's indeed a heart attack triggering the cardiac arrest, timely CPR and access to a cardiac defibrillator is critical to help improve the chances of survival. Most of the cardiac arrest cases due to heart attack will experience a dangerous heart rhythm that causes the heart pump not be able to function effectively. And so if we can get a cardiac defibrillator on board and then treat the patient timely, we can terminate this dangerous rhythm, and that can actually help stabilize the patient while we prepare the patient for transfer. So cardiac defibrillators, or what we call AEDs, are present in most public places such as the shopping malls, sports facilities, and train stations. Learning some basic CPR is a very useful life skill, and you never know when it will come in handy, and you can help to save the life of somebody or even your loved ones. If you're not trained in CPR, calling the emergency services such as the Singapore Civil Defence Force will help to trigger the emergency response, and the team can also guide the bystanders on what to do to help the victim.
So in this situation, how are patients with acute heart attacks being treated?
If one suspects he or she may have a heart attack, they should go to a medical facility that can do an ECG for them immediately. So a quick ECG done will be able to help you to identify high-risk heart attack patients that may require emergency invasive treatment. And this refers to the kind of high-risk heart attacks called ST elevation myocardial infarction, or STEMI. So in this kind of situation, time is muscle, and we should try to open up the blocked artery as soon as we can. And this is to reduce the extent of the permanent damage to the heart muscles. Through the procedures such as a coronary angioplasty, or what we call percutaneous coronary intervention, can actually restore the blood flow to the heart artery and the muscles, and therefore limit the damage and complications of such heart attacks. Now, if the ECG shows that this is not a STEMI, or ST elevation myocardial infarction, the patient can be admitted and then after that undergo further testing with blood tests and serial ECGs. And if the blood test confirms that there is damage to the heart muscle, they will be started on the necessary blood thinning medications and then undergo further assessment of the heart arteries through an early invasive coronary angiogram. In the long term, however, patients will still require treatment with blood thinning medications and cholesterol lowering medicines, which are also known to stabilize heart artery disease.
Is there any difference between male and female for heart artery disease?
Based on the local data, the age of presentation of patients with heart attacks is later in the females, and females tend to seek medical attention later or they get diagnosed later. I think this is partly due to the fact that symptoms that the female may present with are actually more varied. For example, they may get some chest heaviness, burning sensation in the chest, they may get some non-specific shortness of breath or even non-specific symptoms like shoulder or jaw aches.
So what are the risk factors of heart artery disease?
So the common risk factors for heart artery disease include elderly age, physical inactivity, high blood pressure, high cholesterol, high glucose levels such as diabetes, smoking history, as well as a family history of early onset heart artery disease. So if you look at the Singapore myocardial infarction registry data from 2021, up to 3/4 of the patients who were admitted with heart attacks have high blood pressure and high cholesterol. And from my own experience in treating a lot of these patients, many of them actually do not even know that they have high cholesterol to begin with when they were admitted with the heart attack. It is important to actually be able to pick up risk factors and then try to address them early. Being young doesn't mean that you're unlikely to have risk factors for heart artery disease. I've treated patients as young as 24 years old who presented with an acute heart attack. So screening is important, provide the opportunity for you to screen for risk factors and reduce your chance of developing complications like a heart attack or a stroke.
How do you diagnose heart artery disease and why is it so important?
So heart artery disease actually continues to be a leading cause of death in Singapore. In fact, in 2021, if you look at the data, ischemic heart disease accounts for 20.1% of the deaths in Singapore. That's 1 in 5. So with increasing life expectancy and an aging population, it is important to try and reduce the burden of heart artery disease in the population. So if you experience chest discomfort or unexplained breathlessness, they should see their doctor for further evaluation and if necessary, be referred to a cardiologist for further assessment and testing. So common tests that the patients may undergo would include stress testing, such as you may commonly hear of using the treadmill machines or substituted with medications. Heart artery anatomy can only be assessed via 2 techniques currently. One is the traditional way, which is an invasive coronary angiogram, and the other way, which uses a CT technology, such as a CT scan of the coronary arteries. So depending on the severity of the disease that we pick up, patients may or may not require further testing, such as a second-line testing. And these tests can be helpful in helping to determine whether the coronary artery disease that we have identified is significant enough to be treated with a angioplasty, or it can be just left alone with medical therapy.
So what is your takeaway message to all the viewers or audience?
To work with your family doctor to screen and to detect risk factors early and to manage them well. So in this way, you can try and really reduce the chance of you developing a heart attack and a stroke. And if you experience any of these unexplained symptoms such as chest discomfort or breathlessness, you should actually see a doctor to get further evaluation.
That brings us to the end of today's episode of AHVC Heart Channel. I hope you found our conversation with Dr. Liew as informative as I did. Heart health is a topic that cannot be emphasized enough, and we are very grateful to have the opportunity today. If you enjoyed today's episode, please don't forget to share this with your loved ones. Stay tuned for the next episode. Thank you, Dr. Liew.
Thank you for having me.